I will now demonstrate how we apply the pain shield patch to the face of someone with trigeminal neuralgia. In situations where the face is too sensitive to touch and the person cannot tolerate a patch, then what we do is, if the person cannot tolerate a patch on the painful side, what we do is simply apply the patch on the contralateral forehead and wrap it with the cobalt wrap to the contralateral forehead. So for example, if someone has V2 territory pain, but they cannot tolerate the touch of a patch, we would go to the contralateral forehead, apply the patch, and wrap it with the cobalt dressing. In this case, we're going to be demonstrating, however, how we apply it to the right V2 territory in someone who would have trigeminal pain in that area. We would find the zygomatic bone, put the active patch right next to the zygomatic bone. I would ask you to please hold that. And then, using the cobalt dressing, we would simply wrap, not too tightly of course, because we do want it to be comfortable. We would do sort of a twice around. Let me just adjust that. Sorry. Do it twice around with the cobalt. In order to make sure the patch holds firmly. In which case we could just cut the cobalt, as we're going to do here. And again, you have to remember that the person is going to be going to sleep with this patch, because the treatment generally is an 8-hour overnight treatment. It's not a terribly uncomfortable thing to wear. The patch is very light and quite elastic. It holds the patch snug against the face, the ultrasound patch snug against the face, without being constricting. The person can easily swallow, breathe, open their mouth, if you can open your mouth please for demonstration, without any significant restriction from the dressing, because the dressing is light, elastic, and breathable. So once again, we can cut down the patch to make it smaller, to make it fit easier on the face, as long as we don't cut through the wires that connect the electrical driver to the metal plate on the patch. And the patch should be held, in most cases, to the face with the use of this elastic, breathable cobalt dressing. I'd just like to emphasize the ease of use of the Pain Shield ultrasound device. As you can see, the device is about the size of a cigarette box. It has one button, so it's kind of foolproof. You press about 3 seconds and the machine starts. It works automatically, on for a hour, off for a half, on for a half hour, off for a half hour for 8 hours, then it rings and stops. It's as simple as that. It's very hard to make a mistake. There's no particular direction for the connection buttons. And of course, one can wear the device on a belt and send the patch to wherever one needs treatment, whether it be on the face, the shoulder, the elbow. We can run it inside the shirt, or we can run it inside the skirt or pants to get to the foot and ankle area. Of course, once the patch is wrapped, it'll hold on sturdy with the athletic dressing that we demonstrated. And a person, if they want, could even treat themselves during sport or during activities of daily life with the device, which is highly portable, light, and it charges like a cell phone. We're now going to demonstrate the use of this new Israeli low-level laser therapy technology. It is one of the unique devices that is handheld, can be used independently by a patient at home, and yet has sufficient delivery of joules at the right wavelength and frequency to be consistent and congruent with the standards for treatment applied by the World Association of Laser Therapy. In this case, we will ask the patient to show how she would treat herself by simply applying pressure with the device onto the painful area, and with a light pressure, as you can see, the green light lights. The green light is not the laser. The laser is infrared and is not visible. But as the green light lights, that's just to let us know that the treatment is being delivered. But there's also a very small audible click that occurs every few seconds to let the patient know that there is in fact active treatment being delivered. And the idea here is that there will be 6 minutes, about 6 minutes of treatment applied to each painful point twice daily. So if one has multiple painful points, one can plan about a 36-minute treatment session twice a day, in which he can do up to 6 points. He does 6 minutes per point. It is of no therapeutic value to do more than 6 minutes per point, but one can do as many points as he wants. Generally speaking, a reasonable quantity of points is 6 points. It could be 6 points around one joint at different areas of the joint, as it could be 6 different points in 3 different places, such as shoulder, elbow, and wrist in patients who need that kind of intervention. This is low-level laser therapy has reached level 1 evidence of efficacy. There is more scientific proof for its efficacy than most conventional medical treatments applied in pain. It is a very versatile treatment, and with this new Israeli technology, this treatment can now be given in the hand of the patient, who could apply it independently at home.